Now, the implants provided are 4x10 implants here. So this is the implant that we're going to be inserting. I've got my position on the ridge, and I've drilled to a depth of 7 millimeters, and I'm happy with my buccolingual inclination, let's call that the inclination, and then the mesiodistal angulation. I'm happy with all of that. If I wanted to correct anything, I could do so with this side cut drill, or even with the pilot drill if I wish to at the longer depth. So I'm now going to go to a 2 millimeter pilot drill. So I'm now going to use a 10 millimeter pilot drill. Again, I'm making sure that I'm at the right angle. Inserting again just to make sure that I'm happy with the angulation. Yep, that's good. And with the position in relation to the neighbouring to the opposing teeth. We'll see more of this later. So now what I've done is I've established the position, the angulation and the depth. Again, using my depth gauge I can check that. And it's just beyond the 10 as is desired. Then we move up in diameter. The rest should be easy from now on. I take a 3.5, again in this system it's 3.5, 4, 4.5. We're going to be placing a 4 millimeter diameter implant with no fancy stuff. We're not going to make assumptions about the depth, the density of the bone. We're just going to follow the system. This is 3.5 by 10. Again, even though the pilot drill has given me my angulation direction, this can go off offline off angulation, so you have to be careful to keep everything nice and straight still. Now at this stage I can slow down a little bit if I'm in soft bone and if I want to harvest bone. So here you can also control it with your foot control if you wanted to. So what I'm trying to do here is to demonstrate this very slow drilling. You collect bone on your drill and then you can empty that into a sterile dish if you wish to. Collect bone. Obviously I'm just taking it off with my fingers, but the idea is to connect it with a sterile instrument into a sterile dish and to then protect it with some saline so that you can use it later if you wish to. There you are, so lots of bone being harvested. So that's 3.5 by 10. The implant system provides you with a depth gauge for a 3.5 osteotomy, so you can use that again to check that your angle and position are good. If you just take a view from above, yeah, so it's about in the middle, very, very slightly to the buccal. And then with a 4 millimeter diameter by 10 millimeter length drill, I'm going to complete my osteotomy. If the bone is dense, I use a slightly wider drill to get my implant in. If the bone is soft, I use the lower drill. I would stop at 3.5. And there we have it. So, unpackaging the implant. Every implant system has a different way of doing this, but the better systems generally have double packaging. So initially, for example, your assistant, your buddy nurse, would be handing this to your sterile nurse, to your draped nurse, and they would be taking that out themselves. So up until now, this is non-sterile. And then the sterile part comes in there. So that's the implant. The buddy nurse shows the code to the to the sterile nurse and to the surgeon, one or the other, just so they can check the correct dimensions of the implant. And then you can peel this off, and then it is dropped onto a sterile surface without touching the sterile surface. Now, to carry the implant with the implant system, this is the green bit there is the mount. The green part that you see is the mount. And on the box it says whether the implant is pre-mounted or non-mounted. So this one is a pre-mounted 4.1 TS3 implant. So for a mounted implant, you need the bit that carries, the mount driver that carries the implant using its mount, and you attach that. And always, if you're going to place the implant, you always have to change your setting. There we go. So now I've changed it to implant placement setting. This is then detached, usually by your nurse, or if you wish to do it yourself, like so. And the implant is slotted into this carrier, so it's not actually in contact with anything. It's been packaged in a sterile environment and all that. And I'm just going to apply my foot control just to make sure that this is rotating really, really slowly, as it should be. Again, we don't want to suddenly spin an implant into somebody's jaw. That's a very dangerous thing. And then what we do is we lift, we connect it, and we just slide it down and slide it up. Okay, so that it is now connected. Now, obviously holding it this way rather than that way, there's a possibility that it can drop if you hold it that way. So we always hold our implants this way up. Okay, we carefully transfer them to the mouth, usually holding some kind of retraction, cotton gauze here, or some form of protection so that nothing drops into the mouth. And then we bring it. Now, the only thing that should touch the implant when you are beginning to insert it is the patient's bone tissue fluid and bone blood. Okay, ideally blood from the bone and not even from the soft tissue, because the blood from the bone contains the cells from the bone that you want to be in direct contact with the implant surface. And as you can see, because this is a tapered implant system and a tapered drill system, it already goes in a fair distance before it engages, which is a good thing. Then I'm using my foot control now to rotate the implant in, and I'm keeping my hand still nice and straight at the angle previously desired. Okay, already I'm feeling some resistance. I'm just going to grab hold of this mandible, this plastic mandible, and I'm rotating it in. I can feel some resistance. I'm going to turn up my setting to, normally your buddy nurse would be doing this, not yourself. Turning it up to 45 Newton centimeters, reconnecting. You might need to rotate that a little bit, and then advancing it down, down, down. You can see the resistance here. And hey, presto. Now what's happened here is it's engaged just at the crest. Ideally it would do this just below the crest. Now that's the mount. Here again we can check our positioning. So is it correct? It is correct. We can grab a driver or a manual screwdriver, or on the torque wrench we can attach it so that we then disengage the mount. Mechanical screwdriver on your handpiece, or you can even do it like this by hand. And there's your implant placed. At this stage you may wish to advance the implant further. You've got an extra millimeter, remember. So what I often do is on the handpiece I will reverse it on the assumption that it will loosen some of the bone debris, because this is a self-tapping implant. It's collecting bone on the way through, on the way down. So this may have clogged it up a bit. I will often loosen it up a little bit by just releasing it slightly. As you can see here, in this particular circumstance, there is quite a bit there. You can then wash off that excess bone. and then advance it again. It's at 45 still. We can go all the way up to 50 if we wish to. At this stage, if I'm still not happy, I can use a manual driver, but it's always nice to do this on your handpiece so you've got the exact torque. There we are, it's a millimetre below. Thanks for watching.